The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you so much for joining me today. My name is Jacqueline Palmieri. I'm the Director of Aesthetic Operations for Hand & Stone, and today I'm joined by Katie Rieta, who is our National Account Manager and Oxygeneo expert, who's going to really walk you through all of the education, training, product knowledge, and really the science behind the service today. The session will be recorded and shared, so if you'd like to re-review any of the information or if you'd like to pass this on to a team member who couldn't make it today, we will be distributing this as well as the slide deck on the LMS, as well as shared to all of the potential pilot spas owners for them to pass along. And so if you are watching live, definitely feel free to type any questions into the chat. We'll periodically stop as well as leave some time at the end to go through them. And so without further ado, I'm going to pass this along to Katie, who's going to walk us through really all of the details. We definitely have a lot of information to share, so take some notes, but you'll definitely be able to review this information at your leisure as well.
Awesome. My name is Katie, and I'm very happy to be with your the Hand & Stone team today. Just before we start, I just wanted to go a little bit of the history of the Oxygeneo. The Oxygeneo was invented in Israel by a very well-known physicist called Dr. Zinazar, and his motivation to create the Oxygeneo is to create a true oxygenizing facial. There was a lot of oxygen facials on the market, which sort of blow oxygen on the skin, and him being a scientist, he recognized the fact that that isn't the way to oxygenize the dermis and to make a real change in the skin. So he connected with some of his friends at the Hebrew University in Israel, and they came up with the Oxygeneo. The Oxygeneo is the first leading facial technology. It's the most popular facial treatment in Canada, and they say this because we have more units out across the country than any other manufacturer at this time. It was inspired by the long-known therapeutic effects of the hot springs. Basically, the Oxygeneo was designed to enrich the skin with oxygen from within while gently exfoliating the skin and nourishing it with the best active ingredients to maximize treatment efficacy. It harnesses the biological process of the body to deliver oxygen to the area of the treatment in a natural manner as opposed to other technologies which blow oxygen on the skin with very little efficacy. It is backed by real science. It has 2 peer-reviewed studies on it, which is makes it pretty much the only peer-reviewed facial platform out there. And on the system itself, we have an ultrasound, tripolar, and the facial applicator. So it comes with 3 hand pieces. The Oxygeneo is a 3-part facial. We have the oxygenation, infusion, and exfoliation that all happen simultaneously. And then we can do, we also have the optional 3rd generation radiofrequency for skin tightening. So we can do like skin lifting and eye treatments and contouring the face. We have the ultrasound, which is used to break down the product and increases the permeability and infusion of active ingredients into the skin. So basically, it is exfoliation, infusion, and oxygenation of active ingredients. The whole technology was based on the Bohr Effect, which was founded by Dr. Christian Bohr. That was over 100 years ago. Basically, when our body senses CO2, the hemoglobin will rush oxygen to the area, and we have this effect called the Bohr Effect. So we have a temporary increase of, wherever we have a temporary increase of carbon dioxide, we have natural oxygenation from within. And it's very similar to when we're exercising, for instance, we're creating carbon dioxide, we're burning off fat, etc., and burning calories, and our CO2 levels increase in our body, then the hemoglobin will bring oxygen to the area, and our muscles swell and get red, hot, etc. You have this huge gas exchange in our bodies. We're creating the same kind of sensation in our face. The Oxygeneo harnesses the Bohr effect to effectively oxygenate the skin. It creates exfoliation. We have an oxypod that actually vibrates on the skin, and in that oxypod there's a lot of nutrients, and as it's vibrating it starts to do exfoliation. The oxypod has a chemical reaction with the gel that we apply to the skin, and that creates CO2, and that's what's drawing, using the Bohr effect, all the oxygen to the skin. And at the same time, we're blending products on the skin, and all of those products are going to be absorbed into the tissue, and it's going to help the skin with be healthier and glowing and more hydrated. We have at this time 5 treatments. However, they're probably going to be releasing a new treatment every year. We have what's called the Revive Oxypod treatment right now. It has red algae, and it's for skin rejuvenation. We have the Illuminate, which has sepia whites in it. It's a vitamin C with kojic acid and all kinds of active ingredients. It's great for any kind of pigmentation, not just sun damage, but also any kind of hormonal pigmentation. We have the Hydrate, which has blue spirulina. It has Aquasil. It helps our skin retain water, and it's really great for those that dry, and like especially in the wintertime where they're dry and dehydrated. The Balance is for impure skin, or maybe a gentleman that's never had a facial before and you really want to clear out those pores and to decrease any post-traumatic hyperpigmentation, etc. The Balance would be a perfect facial fit for that type skin type. And then we have the green tea facial, which is great for sensitive skin. It even has calamine in it. So as we're exfoliating off the skin, we're infusing calamine, which is a great calming agent, and you can do really sensitive skins with that. And it's, even though it's an exfoliant, it's great for any kind of compromised skin. This is how our products come. We have the Oxypod. In the Oxypod itself, you see all those pretty pink pastel colors. Those are actually the colors of the active ingredients. So the pink, obviously, is a red algae, and the sort of citrus vitamin C is that orangey color, and the gray is the charcoal. All of our actives are in the pod itself, and those are kept in a dormant state, so we don't have to have when they're mixed with our gel, which you see the primer gel on the side, it creates the product live on the tissue. So we apply this aqueous gel, which is, there's nothing in it. It's almost like water, and as we're exfoliating, we're using fresh product on the skin, and it's really remarkable, and it's really highly effective. Then after the exfoliation and infusion with the Oxypod and the primer gel, we clean that off and we add our serum. Our serums are made to complement the exfoliating oxygenation portion. So they match. What is missing in the Oxypod is available in the serum. There's also products in that serum that replaces the lipid barrier on the tissue. So it's going to soothe, and it's going to be antibacterial, and it's going to coat the skin, so we're not going to have any kind of transepidural water loss. The Oxypod themselves was a real revolutionary product. It is packed with a mixture of pure active ingredients in the solid dormant state. The dormant ingredients are activated only when they make contact with the primer gel. So that means that it's maximum stability, freshness, performance, and no preservatives. In all of that, there's dye-free, paraben-free, fragrance-free, vegan, not tested on animals. So anybody looking for a cleaner product line, this would be a really great choice for them. The Oxypod ingredients themselves, again, there are no preservatives, dye-free, etc. The red algae has caffeic acid, ferulic acid. Now, ferulic acid is a powerhouse of an antioxidant, but it oxidizes really quickly. So by keeping all of these more delicate type of antioxidants and acids in a dormant state, you're keeping them for full efficacy. So as it's being blended with our gel, it's in a CO2 environment, not an oxygen environment. So it keeps its maximum efficacy right until it's absorbed into the skin. The blue spirulina has lactobanic acid, niacinamide, shweta, chiarta, and tiger grass. All of those are all about healing and preserving the stratum corneum and keeping the barrier of the tissue intact. The green tea has calamine and copper glutamate in it, and then again, very calming and soothing. It's called a detox largely because it's offsetting a lot of free radicals. So it's detoxing from all of the carcinogens and pollutants and everything else that are irritating our skin. It's that kind of detox. As opposed to now we're going into the charcoal facial. That's going to withdraw all the impurities out of the pore using charcoal. Camu camu is the highest form of natural vitamin C and mandelic acid. So that's going to be like a little bit of a peel, and then we're exfoliating manually, and then the charcoal is going to absorb everything in. So it's going to be a very deep cleansing. And then we have the kojic, the vitamin C and kojic acid, and that particular treatment is amazing for any kind of discoloration, any type of skin type. There's a lot of skin types out there that be contraindicated for any kind of phototherapy, and the Illuminate with the vitamin C, kojic acid, carrot extract, alpha and prickly pear extract would be ideal for them. It's going to help with hormonal discoloration as well. So the serums, in all of the serums, you have shea butter, argan, jojoba, horsetail, and vanilla. Why? The shea butter is a natural UV protectant. This is placed on the skin and infused with the ultrasound after the exfoliation and oxygenation. We want the argan or jojoba to replace our natural sebum, and those are all calming agents as well. The horsetail and vanilla are both antibacterial and also vasoconstrictive, so it's going to reduce any redness right away, and also it's going to kill any kind of bacteria, so you don't have to worry about cross-contamination or anything like this. It's going to really keep the skin nice and clear after the treatments. So each and every serum has all those 5 ingredients in all of them, but they also have very specific ingredients to match the specific treatment as well. So the detoxifying ingredients, Illuminate, Hydrating, Revive, and Balance, all have actually different actives in them as well. So treatment benefits and main active ingredients.
Katie, I'm not sure if like you're moving your head, but it's kind of difficult to hear you only at times. So I'm not sure if you're speaking.
Oh, I'm sitting still, but I'll sit sort of prone towards my, can you hear me better now?
Yeah, it's just like at times, maybe your head turns away from the microphone or something. But it was just a comment that came in.
It could be just the distance. I'll just sit closer to the screen.
Okay.
So the the Oxy Revive reduces fine lines and wrinkles, increases firmness and elasticity, and helps prevent loss of structural integrity. And it's ideal for rejuvenating of aging skin. This is probably one of our more popular facials that we have. In it, the active ingredients is red algae, which is used as a healing mechanism for centuries, actually. They used to use it for wound healing. It's rich in antioxidants and nutrients, vitamins, and restores cell function, reduces fine lines and wrinkles. We have retinol palmitate in it, which is a very forgiving type of retinol. It doesn't really convert to a retinol till it is absorbed. So it's very good even for sensitive skin, and it promotes collagen synthesis. We have ferulic acid, which is a really powerful antioxidant. We have caffeic acid, reduces inflammation, prevents premature aging. And then in the serum itself, we already spoke about the first 5 ingredients, but the reviving serum has Edelweiss extract, which is a very interesting extract. Edelweiss lives high in the Alps, and it's very high above the water table and very close to UV. And by boring its DNA, it really helps our skin to lock in hydration, and it really offsets UV damage. So it reduces inflammation, it's loaded with antioxidants, helps our skin to retain water. And we also have a palmitide peptide complex, which actually mimics TGFE3, which is a type of growth factor which produces collagen type 1. So very strong treatment for anti-aging. And this is, again, the listing of the ingredients for the serum. It's jojoba, argan, shea, Edelweiss, palmitide peptide, and the tripeptide 5. So argan oil and jojoba, both of them are non-comedogenic oils. So when they penetrate the skin, it's sort of replacing our natural sebum, but it does not clog the pores, and therefore you're not going to have the same kind of sick kickback with sebum that you would with other more drying type of exfoliants. A lot of times when we're doing like a strong peel or something like this, our skin senses that it's very dry, and if we don't get that, we don't replace that lipid barrier again, we're going to produce more sebum. So all of our ingredients, all of our serums contain these ingredients to normalize oil function afterwards. And the horsetail vanilla, as I mentioned before, very strong antioxidants, very strong antibacterial, anti-inflammatories. They help reduce oxidative stress and premature aging. The horsetail, for instance, is a lot of trace minerals in it, and it's very great for, again, antibacterial and anti-inflammatory, which is very important to calm the skin down right after they've such a strong exfoliant. And the shea butter natural UV, it's equivalent to about a UV4, which isn't incredibly high, but it's still a UV protection. Also helps retain the lipid barrier, and it's really nice emollient. And it's really helps protect collagen, elastin fibers.
Katie, are you there?
Yeah, I'm here. I just was waiting for the next slide.
Oh, this was. Okay.
Oh, sorry. Yeah. So we can just go into the Illuminate. The Illuminate brightens the skin tone, reduces hyperpigmentation, prevents sun damage, ideal for uneven and dull complexions. And in it is the again, vitamin C, which inhibits tyrosine enzyme and promotes collagen synthesis, kojic acid, which is a powerful tyrosine inhibitor, alpha-brutin, which is a safe natural alternative to synthetic hydroquinone, carrot seed extract, which brightens the skin tone and is very strong antioxidant. And prickly pear has a lot of natural trace ingredients in it, so it's great for, it has high content vitamin K, which is really great for underneath the eye bags. It has copper in it, which is really good for collagen enhancement, one of the highest sources of vitamin E, so it really reduces irritation and inflammation. And then we have the illuminating serum, which is argan jojoba. Again, we mentioned these a number of times: shea butter, horsetail vanilla, the D-acetylcholine, which is a tyrosine inhibitor, the undecimylphenolphthalein, which is what they call a sepi white. I believe I'm going into all these details, and we actually have a slides following up with them, so I'll just wait to give you more details then. And then the caprylic triglycerides, which are just basically your carrier. And you can just go to the next slide. Oh, didn't. Guess we just had the other extra slides in the other one. The Oxygeneo hydrate with blue spirulina rehydrates and moisturizes dry skin, repairs the skin barrier function, reduces redness and inflammation, and is ideal for dry and dehydrated skin. And here we have all the actives in the OxyPod. So we have the blue spirulina, which is loaded with proteins, vitamins, minerals, other nutrients. It's a really high level of protein. People like to eat it, actually. If you go into health food stores, it's a great source of protein, but protein is really necessary to create and to restore collagen. So the blue spirulina is really great for adding to our collagen levels. Lactobanoic acid is non-irritating polyhydroxy acid and helps shed damaged skin. Niacinamide is an active form of vitamin 3, helps stabilize the lipid barrier, prevent dehydration. And Schwartz-Chiara thickens the epidermis and reinforces the lipid barrier. And the tiger grass helps promote the synthesis of collagen and hyaluronic acid. Tiger grass is amazing for healing as well. There's a lot of properties that it really helps promote. Again, all the first 5 ingredients in the hydrating serum is the same. And then we have Aquasol, which optimizes water circulation in the dermis and epidermis. Hyaluronic acid holds 1,000 times its weight in water. And these kind of ingredients is why I really like to infuse them with our ultrasound. The hyaluronic acid, for instance, is a polymer. It's a huge molecule size. So when we're infusing all of these serums in with our ultrasound handpiece, you're going to break down that product into smaller molecular bits, and it's going to really infuse into the skin nicely. We have ionic polysaccharides, which help the skin barrier keep well hydrated. And the D-ribose boosts cellular energy and normalizes barrier function. It's actually a sugar from red algae, which goes back to our original facial that helps heal. So D-ribose is really important for maintaining cellular normalcy as we age. And in the hydrating serum, we have all of these that I mentioned before, the shea, the aquasil, hyaluronic, polysaccharides, vitamin B, and D-ribose. Now, the balancing treatment, it's very unpopular for younger skin types, but you can use it for all skin types. If someone hasn't had treatment for a long time, or it's a gentleman coming in, he's never had a facial before, I always like to start with this. Why? Because it purifies clogged pores, and a lot of times all of those filaments around the nose, etc. It's really great to have the charcoal, so it's really going to withdraw any of those impurities. Helps to prevent breakouts, ideally for oily and acne-prone skin. Mattifies oily skin as well. Because it's not dehydrating, I can use it on any skin type, unlike a lot of other things that are geared more for oily skin. This, you can still use it on and even a dry skin. It's still going to be very hydrating because of the other ingredients in it. So in the Oxypod itself, you have a bamboo charcoal, which purifies impurities and clogged pores. It acts like a magnet, just like as we're manually exfoliating the skin and all the debris is coming out of the pores, the charcoal just absorbs it. So when we wipe the skin clean, all of the bacteria and debris, etc., from the pores just wipe right out. The camel is a very high source of vitamin C, helps with soft tissue repair. It is 60 times more vitamin C than orange, and mandelic acid is a non-irritating alpha hydroxy acid. You're going to see in a lot of the Oxypods that there's always a little bit of an acidity to help clear out the pore as we're manually exfoliating. So we get such a great cleanser, cleaning capabilities with it, and then of course all the impurities are absorbed into the charcoal. So we do the exfoliation, infusion, oxygenation, we're clearing that off, and then we put on our balancing serum, and of course the first 5 ingredients are the same, but in this serum, what's unique is the azelaic acid, which helps soften pigmentation, prevents breakouts. It's also really good for offsetting UV. If you actually look up azelaic acid, I think on Wikipedia or one of them, they had a really great detailed of the benefits of it, and it's very good for radiation damage as well. Biotonical peptides is antibacterial, so it actually targets P. acne bacteria and kills it, which is very important. And then we have salicylic acid, which a lot of people are still familiar with. It's a very effective exfoliant, caloric cleanser, and antibacterial. So it's working very nicely with the bacteria, with the botanical peptides. And again, here are all the ingredients for the balancing serum that I just mentioned. Then we have the Detox. The Detox removes toxins and impurities and reduces redness and irritation, helps prevent premature aging, ideal for sensitive skin. This is also a great treatment for anybody that not just sensitive skin, but say you had more aggressive treatment for something else a couple of weeks ago. In the summertime, if someone experienced sunburn a few weeks ago and they just want to really help heal their skin, this would be, you wouldn't do it right away. You'd wait for like 2 to 3 weeks after, but this would be sort of the go-to healing facial for them. So it is good for all types of more sensitive skin. In it is green tea, which helps protects the skin from oxidative stress and UV-induced damage. The copper glutamate, which promotes collagen elastin synthesis and deactivates free radicals, a very strong antioxidant. And the calamine, which alleviates itchiness, irritation, and redness. There's a lot of people out there walking, like they have very sensitive skin. This would be such a nice treatment for them. So you're exfoliating with that, you're oxygenating with that, those ingredients, and infusing all of those ingredients, which is really calming to the skin. And then you're going to cleanse the skin. Then you're going to add your detoxifying serum, and you're going to work that in with your ultrasound. And in it is marula oil, which really reinforces the skin barrier, and it's anti-inflammatory as well. The white water lily soothes rashes and irritations, and it's really great for healing and for restoring and for inducing collagen enhancement as well. We have also the soothing complex, which helps calm the skin as well. And the organo jojoba, of course, is going to reduce any kind of transepidural water loss. So protocols and guidelines. The treatment itself is very easy to operate.
I just wanted to comment that if anybody has any questions, please feel free to type them into the chat.
So normally you can do this many different ways. A lot of times people have 6 sessions. They'll buy a whole package. They do them at least 2 weeks apart. And lots of times they're doing it every 4 weeks. If someone had really impure skin and very congested skin and teenage skin or something, or they had breakout issues, they probably have it 2 weeks until that some resolve is seen, and then they go back to their 3 to 4 week period. A lot of times people are using the Oxygeneo just for anti-aging maintenance, so they're doing that every 30 days. And the treatment itself is divided into 2 steps. You have the Oxypod and the primer gel, and that you do the exfoliation anywhere between 5 to 8 minutes. Most people do about 5 minutes because it is quite an intense treatment. And then you cleanse that off and you add your serums, and that you infuse for about 8 to 10 minutes with the ultrasound. And then ultimately we have a massage tip that you're going to do massage with, which helps not only increase the absorption, but also really helps with lymphatic drainage. So it's basically a 2-part facial, but with the serums you do the ultrasound and the massage.
And I do want to point out that this is pretty much the protocol for the actual oxygenation and infusion portion. We do have full clarity and Dermalogica protocols from start to finish with this looped into it. And the great thing is we are membership based, so our clients are coming in monthly anyway, so they can easily upgrade to any of these Oxygeneo options. And if they want to come in more frequently, so like do a full facial and an Oxygeneo treatment with it, but if they want to come in like every 2 weeks, let's say, they could do the full facial with the Oxygeneo and then possibly the next one do an express 30-minute one. So it's a little bit more cost effective and a little bit easier on time. But this is super customizable based on your client's time constraints, budget, and what they'd like to achieve in their sessions. We did have a question come in. Katie, I know we're going over contraindications and everything at the end, but it was if these facials are safe for pregnancy.
We never test on pregnant women, so we can never say that it is. In order to have a study on it, there's nothing in it that's, hugely, it's pretty clean product. I don't think there's anything really unsafe, but we would never do a pregnant woman with any of our things, largely just because of the lack of studies, and nor will we ever do a study on that.
So do you just suggest that they have a doctor's note if they're going to be having it, or not perform the treatment at all?
They can if they want. I think Polygen is a manufacturer. They just don't go to there because you really do have to have an inordinate amount of studies to prove safety when it comes to pregnancy, and that also involves working with pregnant women, and they just don't. So there's nothing really in it that would be any worrisome, but they will never take responsibility for that.
Okay. And what about, I had another question, can a pregnant esthetician perform these facials?
Oh, yes, that's not an issue. I mean, it's a very clean product. It's not so much even that it's dangerous or anything like that. It's just we don't have a study for it. So we'll never say yes if there isn't a study.
Okay. And I would say, like, just for extra precaution, if they wanted to wear gloves, then, that would even
Yeah,
add another
absolutely.
layer.
Absolutely.
Yeah. You're welcome, Roxanne. Does the client have to follow a specific regimen after the service?
Not really,
It's
but
really
normally what I do,
non-invasive, right? Like, so it's not,
it's
I wouldn't
so
say it's even,
non-invasive. Yes, but what I'm always explaining to them, it's like this is the time to go over their home care, and I'm aware that you have a lot of wonderful home care at your location. So I always suggest that they use fresh product because one of the things they ask first is how long does the results last? Well, I'm always saying it's going to last as long as you're reinforcing your skin with great home care at home. The Oxygeneo was really meant to boost the results of your home care as well. So if they're using great home care, I don't want them putting something on their face that's like a year old, that's been opened all that time. I want them something fresh and wonderful and active ingredients that's really going to work with their skin, and they're going to have a really great result. But there is no specific protocol other than the hand and stone protocols with the products that you already have. Body treatments, I don't think you guys are going to get into that, but they do body treatments.
yeah, we're doing the back and the chest, like it's labeled
Oh, are
on
you?
here.
Okay, awesome.
Yeah,
Yeah,
see, back and chest. So anytime you're doing a back facial or a chest facial, you can upgrade to that.
yeah, absolutely. And it's great because if they have a lot of discoloration, you can choose the Seppi Whites with the Oxy Illuminate for anybody with blemished skin or keratosis pilaris on the back of their arms and everything. The charcoal is a really great solution for that. And we have these box of primer kits. So you can just use an extra, instead of using 2 pods or 2 kit or 2 treatments to do a large area, you can just get an extra primer gel and do the entire back and back of arms. Not a problem because your pod would last that exfoliation time. So now we're going to talk about the Tripolar technology, which is a 3rd generation radio frequency, and it does skin tightening. And as you can see on the handpiece there's a little thermometer in the middle, and that is a wonderful tool because it prevents you from overheating the tissue and breaking down the fat pads of the face. So this is just going to do a contraction and is not going to break down any fat in the tissue, because radio frequency can do that if it's a higher temperature. And this is going to be great for eye bags and all of those sensitive areas that you can treat with very few other things. This does a really nice job for contraction.
I just want to answer a couple questions before we move on. The one question about preparing the skin, cleanser, moisturizer, things like that. That was just the protocol for actually performing the Oxygeneo.
Yeah.
So like the Oxygeneo pod and the serum infusion. On the online course, there's going to be linked in the resources the full Dermalogica and full Clarity protocols. And that will have the different steps or customizations for preparing the skin and what to be performing after. This is really the bulk of the education and knowledge. That's really just following along the protocols in what you're cleansing the skin with, what you're moisturizing with, and the different upgrade options too. I do also see another question. Can this facial be performed in the summertime?
Yes, it can. Of course, they're always going to be using like SPF afterwards, but they should be anyway, any time of year. So I don't find it particularly photosensitizing at all, but they should always take care. And when they're doing this, because it's increasing the absorption of product, you always have to let them know, like, I would not, have an Oxygeneo, no go plunging in a chlorinated pool or something like this. They do have to take care, but it's really easy to offer these treatments in the summertime. In fact, because of events, a lot of times people have them done in the summer. So introduction to radio frequency. Radio frequency is a technology that uses high frequency electromagnetic waves to induce heat into the tissue. The first person to recognize the therapeutic effect of RF was Nikola Tesla in 1891. RF technology was embraced by the medical community through the 1920s and has been maturing and improving ever since. Today, the medical applications of RF technology includes electrosurgically ablation, hypothermia, treatment of cancer, neurosurgery, MRI, ophthalmology, and more. In the last 2 decades, RF has been become the gold standard behind the medical aesthetics for non-invasive skin tightening and wrinkle reduction. It goes much deeper than laser, and it's not as irritating. Laser is sort of focused on the surface of the skin, which is really hot. RF is sort of targets the waters of the tissue, which is deeper, and there's not as much nerves there, so it's very comfortable. RF is considered a color blind technology, can safely be used on any skin type. In the medical aesthetics, RF electrodes includes RF currents which travel through the skin. The natural resistance of the tissue transforms the electrical energy into heat. So it's like water has high electrical resistance, so the water of the tissue heats up and causes that near wound healing, which causes the contraction. As a result, the temperature of the skin increases, triggering the body's natural healing process, and includes accelerated production of collagen, elastin, and hyaluronic acid. And the tripolar is the most advanced RF for aesthetics, and it's a patented modality, so there isn't any other company other than Oxygeneo that has it. It's a unique technological features that makes it safer and more comfortable because it never sparks. There's more negatives active at the same time, so it just never arcs or sparks. So if I'm doing around delicate areas in the face, you never have to worry about breaking contact and sparking a client, which can be uncomfortable. The evolution of non-invasive RF, we have all different types of radio frequency. You have monopolar, bipolar, and tripolar, or multipolar. And like other medical technologies, RF has evolved over time to become safer, more effective, and patient-friendly. What has changed over the years? The number of RF electrodes used to deliver the RF energy, the RF power needed in order to get heat treated at therapeutic temperatures, and the safety risk or risk factors. So monopole always used a huge amount of wattage, and it flows through the tissue to a return pad. And yes, it heats up really nicely the surface, but it has like just a huge amount of wasted energy that goes through the tissue. It can be very uncomfortable, and it can cause necrosis in tissue too, which is unwanted. So you have to, it's much stronger, more uncomfortable treatment. And yes, it has an end result, but you're wasting a lot of energy. Bipolar is when you have a cathode and anode, a positive and a negative, and energy is flowing through it. Cineron, who did the first studies on it, said that the amount of depth into the tissue is about 50% of the distance between the poles. So typically a bipolar will put the poles further apart in order to have good depth into the tissue. The problem with that is if you lift one of the poles, you get a shock because you broke current. And so in order to do that, they put a lot of gel to reduce the shock. And then, of course, there's a lot of RF in the gel, not in the tissue. So there's positives to bipolar, but there's a lot of negatives to them as well. We created the third generation tripolar, which just means there's a lot more poles active. And having more negatives means it's always grounded almost every configuration. Also, the poles are closer together because we're not relying on putting the part like bipolar. The poles are closer together, and it creates what's called magnetic resistance. It's like putting two magnets together, and it's going to cast the energy deeper into the tissue. So it's going to be more intense and less diffusion of heat. So we're actually using a lot less power, but getting deeper and holding the temperature better. So I always use the analogy. It's like LED versus our old big box TVs that they used to have that generated a huge amount of energy to create the same illumination on screen. It's the same thing here. It's just a smarter evolution of energy, and you're using a lot less energy, so it's a lot less dangerous and a lot more comfortable.
We had a question come in, what areas to avoid with RF energy?
Well, obviously, I'm doing a nice eye treatment, but you can't get inside the ocular socket. So that would be an area that you would never do it. You'd never go over thyroid. So if I'm doing a neck treatment, you avoid thyroid in those glandular areas. You would only be using this on thin skin, so your areas that you avoid is decreased. But if I was doing an RF on a body, for instance, you wouldn't go over underarms, you wouldn't go over breasts, you wouldn't go over any kind of glandular area like that with radio frequency.
Gotcha. We had another one about different upgrades like LED and such. And while
yeah, you can do
Katie,
an
when
LED
we sorry, what was that? Hello?
Oh yeah, you can do LED after this treatment, not a problem.
So yeah, there wasn't anything contraindicated based on Katie's, explanations of everything. It was just that the full RF takes 40 minutes. And so while needing to cleanse the skin, analyze, and then the moisturizers and everything after, it comes really close to the full 50 minutes, which is what we're scheduled and allotted for. So these are all things that, we're looking for in the pilot program, and we're looking for feedback from everyone. So right now, it's not that it's not contraindicated, but if it's doable, that's great. Or, in your spot, estheticians end up going over and they have the time. But right now, it comes really close to the 50 minutes with LED, new face, anything like that, even just performing the 40-minute RF. So that's the only reason why, and you'll see that in the protocols.
This is just a scan showing how the heat is much more focused when you're using more poles. It's just there's no diffusion of energy. When you have poles apart, the energy scatters. So again, it's using less energy smarter, and the poles are closer together, so you're just having a bigger impact and less diffusion of energy. It's creating more heat areas. The advantage of the tripolar is it delivers focused RF through multiple electrodes and heat fields. The tissue is heated, is volumetric and homogeneous. That allows the practitioner to use a much lower power to heat the tissue from within. Really, it was irrelevant what wattage you use. What's important is that you're hitting 40 degrees, which that thermometer will tell you when you're hitting 40 or 41 degrees, and it will not allow you to go hotter than that, which makes it absolutely the easiest RF out there to use. It's governed at the appropriate temperature. So its built-in sensor prevents overheating. Electrodes are small, so you can get into all the nooks and crannies, and the power settings are all pre-done. So it's just low, medium, and high. I'm always typically using it on a high. Immediate skin tightening and long-lasting results. When you're having the RF, you usually have a nice contraction because I'm just heating up that collagen right away, and you're going to have a nice contraction immediately. They're going to look in the mirror and go, wow. That usually releases over the next 48 hours. And the true contraction, the long-term result happens about a month later. So you're going to have this contraction, then release, and then another contraction is happening closer to our 30-day cellular turnover. Three RF power settings are available. I'm almost always, when you're first starting out, I'm usually using medium, and once you're an expert, you can use high. I like to use the higher temperature because it just gives me a little bit more flexibility over a larger area. And when you're choosing high, the RF will shut off once it exceeds 41 degrees. So as soon as I'm hitting 41, lots of times I don't even care if it hits the orange button on it, because it'll still be at 40, which is a great contraction. It just gives me the capability of moving a little faster and doing a larger area when I'm using it on high. So the benefits of the temperature sensor is that it's going to stop you from overheating, and it's going to be very easy. You're not going to be taking a thermal temperature for this. For ultrasound, you have enhanced infusion. And probably a lot of people out there are already familiar with ultrasound and what it does.
Before we go into that, just one more question for the RF. Are there any side effects after the service?
No, I've used this particular RF, a lot of other radio frequencies, because I've owned other radio frequencies, and you can spark and arc, and sometimes it looks like little welts. I have never seen that with this. The only time you would ever have any little mark on their skin or anything like that is if you went over an area that didn't have glycerin in, and you'll be trained how to use it. So that just won't happen. So I would say no. I've never seen anybody hurt anybody with this particular handpiece.
And I will say that with the RF, it uses a different technology, and we know that that's in the treatment room that we're able to perform that. But for any spas that are recently launching new face and that microcurrent technology, that is an amazing take-home addition to maintaining and cumulatively achieving those increased lifting, tightening, and toning results. So that is like the absolute perfect pairing for in the room and then a take-home product.
Yeah. So ultrasound is a high frequency acoustic wave which cannot be detected by human ear. Ultrasound waves are numerous applications in the medical field, including diagnostic imaging, physical, occupational therapy, tissue measurement, tumor destruction, and more. It depends whether it's focused or unfocused. In aesthetics, high intensity focused ultrasound is used for soft tissue heating and cavitation of fat cells. Another therapeutic ultrasound is called transepidural drug delivery or non-invasive infusion of topical drug products through the barrier with ultrasound energy. So lots of times you're going to be hearing all different types of ultrasound, and people are going to be asking you questions on this particular ultrasound. This is just for infusion. The ultrasound applicator, it's non-focused. It's just going to break down the product. The ultrasound applicator for the Oxygeneo is specially designed to infuse ingredients with the active ingredients through the skin barrier into deeper layers. The ultrasound waves are targeted to the dermis, epidermis, and will create micro vibrations between the cells and increase skin permeability. At the same time, the acoustic waves increase kinetic energy in large molecules, allowing deeper absorption of product. This technique is widely used in hospitals to deliver drugs into the skin. It's also known as sonophoresis. Ultrasound may have therapeutic benefits due to its unique interaction with different structures in the skin, and the ultrasound applicator allows you to increase the infusion of nutrients in active ingredients into the skin, increases blood circulation into the treatment area, improves cell oxygenation and metabolism, improves moisture retention in skin cells, shrinks dilated pores, and relieves puffiness around the eyes. So it really does do a difference. It doesn't feel like much when you're doing this. It just feels like a little smooth, almost cool at the beginning. It will warm up, but it really does do a wonderful thing for the tissue, for microcirculation, etc. This is how we do our treatments. We cleanse the skin, and if you're going to be doing the radio frequency or the tripolar, we're going to be doing the tripolar first. Why? Because I want to put my glycerin on and increase all of that cell metabolism with the heat and contraction. Then I'm going to get into the oxygenation with the Oxygeneo handpiece. You're going to have a better oxygenating effect because you've already preheated the tissue. And also, when you're doing the exfoliation, infusion, etc., I don't want to be putting glycerin on after I've already exfoliated you. So I'm always doing the tripolar first, then the Oxygeneo, then the ultrasound for infusion with the serums. And then we have the massage tip that also comes with the machine that you can do a really nice massage. It's really great for TMJ or just for lymphatic drainage. And then you're going to be moving into your personal skincare afterwards for your moisturizers and sunscreens afterwards. So the Oxygeneo treatment exfoliates the stratum corneum and enables better tripolar. This is like normally we're doing it the opposite. When you're starting with the tripolar, the RF increases blood circulation, improves the penetration of active ingredients. So we're always doing the tripolar first.
So you're doing the tripolar first always?
Yeah. Yeah, they have some people, because in Europe sometimes they like to do the Oxygeneo because the hydration they say helps improve the tripolar RF. When you're doing a nice cleansing and you have the other glycerin on it anyway, I just find the tripolar heats up really great without and I want to have the exfoliation and all the infusion with your serums in the skin afterwards without putting glycerin on afterwards. So I'm always using the tripolar first. Maintenance of machine, it doesn't have any maintenance. It's basically a computer, so we just keep it nice and clean. I use cavi wipes on it. It has not deteriorated from me, from using it. You can use also just spray 70% on a soft cloth and wipe it down with 70% alcohol to keep it clean. Obviously, you never submerge the applicators, and you do not you make sure you just don't drop them. You handle them carefully. Contraindications. Under 18, you would have to have parents' consent, pregnancy or nursing, because we don't do the studies on them. So that would be a contraindication. Pacemaker, anything metal, particularly with That wouldn't be an issue for me for just the patient, but you wouldn't be able to, I wouldn't do any of the radio frequency, etc. on them. Metal implants, that would be a contraindication for the radio frequency. I don't care about the Oxygeneo, but the radio frequency, that would be a contraindication for. Don't treat over lifting threads, fat grafts, or silicone implants. That was more for radio frequency as well. Mind you, if someone had any kind of lifting threads recently, because that's starting to be a fad, I would probably decline because they could have irritation, just the blood circulation in the area. You'd have to go back to the medical professional that inserted them to see if that would be okay. For the radio frequency, you don't go over thyroid, armpits, breast, or eyelids. Any kind of cancer would be contraindicated for any of the hand pieces, especially skin cancer or pre-malignant moles. Impaired immune system due to immunosuppressive diseases such as AIDS, HIV, or like if they're on a steroid regime, they had some type of replacement surgery, then they're on steroids for the rest of their life. That would be a contraindication for me. Severe concurrent conditions such as cardiac disorders with uncontrollable diabetes, clients with a history of diseases stimulated by heat, such as herpes simplex. You can take an antiviral and have the treatments done. And I probably would refrain from the radio frequency. Active condition in the area, such as SARS, active acne, psoriasis, eczema, and rash, as well as excessively freshly tanned skin. If someone is on the beach too much, you have to wait several weeks before you're exfoliating because their skin's too delicate. History of skin disorders such as keloidic scarring, abnormal wound healing, and dry and fragile skin. Any surgical, invasive, ablative procedure in the area before complete healing. Known allergic reaction to any ingredients in the gels. As per practitioner's discretion, refrain from treating any condition which makes it unsafe for the client. I would also, precautions, if they're getting any kind of Botox or filler, you should wait 2 to 3 weeks post-treatment. Again, the radio frequency, I get stuff all the time with the radio frequency over RF over the filler, will it break it down? It will not, but it has to settle there. Lots of times you have subdermal bruising when you're doing fillers, so you would never heat that anytime. You have to wait, make sure that everything is settled first. So any kind of surgical, invasive, ablative procedure in the area within 3 months. A facelift, eyelid surgery, skin resurfacing, deep peeling, etc. within 3 months. And I'm talking like resurfacing, not just a light peel. Injecting chemical substances, threads, synthetic fillers in the area upon approval of the treating aesthetic physician. Again, fillers 2 to 3 weeks post-treatment. Prior to treatment, you can have an Oxygeneo and have like Botox and filler done the next day. That doesn't really matter. I'm worried about after because I don't want that blood stimulation after I just did Botox. Accutane or retinol products you'd have to refrain from, and patients with a tendency of transient breakout, that isn't a precaution. Lots of times this does not cause breakouts the way other exfoliants do because we have so much antibacterial and calming agents in the product. So they may have a breakout, but it's few and far between that never has. But they just have, if someone had really super sensitive skin that way, I would do it right beside before a big event for them. Side effects, I don't even know if I've ever had. The only time I've ever seen a side effect was probably with our previous treatments, and that was I had a couple of people that had some allergies, and so they had high histamine content. They take an antihistamine and they were okay. So I rarely would ever see a side effect with that. However, allergies are always possibility because there's lots of botanicals in them. If you were using a really heavy hand with it, because those pods do become rough, you were really like doing too heavy of a hand, but everybody's going to be trained and do a great job so that you don't have to worry about that. Itching or irritated skin, I guess it would be just someone just really manhandling someone and doing just an excessive scrub on them, or allergic response, scratch again, just heavy-handed. That just shouldn't happen. Visible capillaries, I've done treated people with very sensitive skin, and I've never had an issue with that. However, Sometimes people can have other issues underlying, and you do the treatment and something can come up afterwards. You have to just make them aware that this is causing a lot of blood stimulation, so you'd have to be careful of those areas or avoid them if there's just a lot of visible capillaries in the area. Sensitivity, I've never seen it happen, but anything's a possibility. Pigmentation, again, never seen it happen, but we have all of these side effects listed just in case, because you don't know what your clients are going to be doing at home care, etc. Or if they were scratching at themselves or something, they could cause pigmentation. If they had allergic response and they started itching themselves, that could cause some pigmentation.
And so we have created several different training guides for you. This is definitely not the last stop in your training process. This is just the start and just the beginning. So I'm going to go over where you can find a lot of these different resources and materials, but we have created an Oxygeneo hand and stone training checklist where you'll go through various different portions of your training. And congratulations by viewing this webinar today, because you've completed, the first part in that. And then you'll go through the hands-on in-person training with Katie. After that, you'll complete your treatment log just to make sure that you're feeling comfortable, you're able to understand the protocols, speak to the services, and overall, when you go to perform these treatments with your clients, we make sure that you're set up for success and feel as confident as possible in providing the treatments. And so the online theory course is really going to be the first part of this. So I'm actually going to be linking this specific webinar in there. So that way everybody else that's not viewing it today, and if you're viewing it anytime after this or getting certified, it will be in there. But this online theory training for Oxygeneo is going to be the first step. We're going to go more in depth in some of these treatments, watch some videos on it being performed, and just overall have a better understanding of the service. So it's going to be on the LMS under training, Canada content, EST content, and then Oxygeneo. On the right side will also be all additional tools and resources. So like contraindications, the Dermalogica and Clarity protocols, the training checklist, practical log, the full manual with all of the details of all the ingredients and science behind the service. So you'll really have everything that you possibly need. And so when you're done with that service, you'll want to save that, print it out, and then make sure that your manager or owner keeps that in your employee file for when Katie comes on site for your training. So as I mentioned, we have tons of tools and resources for you. So we have the Clarity different upgrades, and we have the Dermalogica ones. Now keep in mind the different upgrade options are going to be just with that Oxygeneo facial. The Oxygeneo Premium Experience, which I'm going to go over in a second, which has like the RF, Oxygeneo, ultrasound, and then also the full face RF. There's really no time for additional upgrades. But again, I am open to feedback, and this is a test program. So I can definitely be flexible with that, and we can figure out the different ways we can possibly make things work. But that's really just what we had looked at with Katie, with Dermalogica, and with Clarity, is there just wouldn't be much time for anything else based on a 50-minute facial. So we have the approved facial combinations guide in that folder, Dermalogica and Clarity RX facial protocols, hand and stone training guide, contraindications chart, and as I mentioned, we also have that practical log and the training checklist in there as well. I did see a question come in. Can you please share the link for the theory training one more time? It's going to be the LMS, so it's handandstone.tortle.net. Just ensure that you're set up with a username and password. If you don't know what that is, your owner or manager can help you find that. And so the different treatments that we're going to offer. So these first three at the top are going to be based off of a 50-minute service. They're all going to be upgrades. So your client will likely be booked for a classic facial, whether that be Dermalogica or Clarity. That's how our spa associates will typically book it. And then at that point in the analysis and in consultation, that's when you can talk to them further about the different Oxygeneo treatments based on their skin concerns. So if they want to do the full premium experience, it includes a 20-minute RF skin tightening Keep in mind, that one is just the upper face. So you'll learn that more when you go through the different online trainings in that course. But the 20 minutes is just the top of the face. So it's not a full face. The customized Oxygeneo exfoliation and the ultrasound infusion. So again, that's going to pretty much take up about over 40 minutes. So you're going to not be able to really upgrade much else in that. We also have the RF full face skin tightening. Same thing, you can position that upgrade to your clients in the consultation or the analysis if they're really looking for that full face skin tightening. Then we have the Oxygeneo only, but that's going to include the ultrasound. And again, that will be an upgrade to a facial, which on the approved facial combinations guide would allow for time for different other upgrade customizations. We do have two 30-minute options. So we have the RF skin tightening eye lift, which is the same thing that's encompassed in the premium experience one. So that one's just going to be the top portion of the face. And then we also have the express Oxygeneo, which is going to be, basically in the protocols, you'll see it's going to be a very quick cleansing, the Oxygeneo and the infusion for a little bit less time in that infusion than the traditional upgrade, and then putting on the moisturizer and protectant. So that's really good for clients that maybe want to do this more regularly, like every 2 weeks, and helping with their budget, or for clients to use interchangeably. So doing that full, Oxygeneo 50-minute service monthly, but then looping this one in every 2 weeks. So definitely just different customization options based on our clients' needs. But these top 3 are all going to be upgrades. So whether that means that you're positioning it to your clients in the treatment room, or possibly, our clients are hearing it from spa associates or seeing it in marketing and might even be requesting it directly with the spa associate. So these are our different options. And this is just so you can see it in service codes wise, how these would be written in the system on your books. And so as you can see, these top 3 are add-ons because they're upgrades, and then these 2 are just standalone services. And that's what we have today. So I hope that you enjoyed this session. Again, this is just the beginning for you all in really learning more about the science behind the service and feeling comfortable positioning this to your clients. So really the next step is just to ensure that you're completing that Oxygeneo online theory course, and then just connecting with your owner or manager to find out when that hands-on training is. And then from there, completing your practical logs to be ready to start servicing your clients with this amazing technology. So if anyone has any last minute questions for either myself or for Katie, please feel free to type them in. Or if you just want to let me know if you're excited or not. I know I'm excited.
Yay.
All righty. No questions, but I'll rattle off some excitement. Roxanne, I am ready for it. Maria, thank you. Super. Miriam, it is super exciting. Robin, woohoo, excited. Roxanne, again, Roxanne, I think you're signed in under other people. I'm so excited. I can't wait. All right, amazing. I'm going to get this recording and slide to, it's Roxar. Oh, hi, Roxar. Oh yeah, I'm really excited for you to experience this actually. Alrighty, I'm gonna get this recording and slide deck out to everyone. Please feel free to reach out should you have any other questions to myself, Katie, or the both of us. And can't wait for you all to launch it. Thank you so much. And thank you, Katie.
Yes, thank you for having me and looking forward to meeting everybody.
Alrighty, take care.
Bye-bye.